Welcome to America's Healer with Dr. Jason West. Dr. West and his guest experts are about to open your eyes to a whole new perspective on the medical world. Now, here is your host, world-renowned Dr. Jason West.
Hey everyone, welcome to America's Healer with Dr. Jason West. Inside of our studio, I'm so excited to bring my guest in. Misty's with me. Misty's been with me for a long time. She's been a huge part of our clinic and our clinic success, and I'm just so excited that she's here. We're going to be talking about what we wished sick people knew. And before that, we're going to set the table a little bit with Misty's journey and how our paths crossed and some other things. We'd like to thank our sponsors, which of course is the West Clinic, where we both work. We've been there together about 16 years, I think, right, Misty?
Yeah.
Okay, so we're going to go through that journey in just a minute. We also want to thank our other sponsor, Personalized NX. That is a supplement company that makes customized formulas for her. And also, we are doing a special in our office on a twice daily multivitamin called Superhero Essentials. We literally formulated that so that you could have your fats, your multivitamins, your enzymes, and the miracle mineral magnesium all in one pack. If you go to our store, you can actually get about a 30% discount if you select the auto ship. So we're excited about having those different sponsors. And so what I wanted to be talking about today is what we wished we knew people knew about before they entered into the healthcare journey and really before they got sick. And I'm excited that Misty's here because she sees literally a front line of what happens when people start, how they are in the middle and how they are at the end of these medical miracles. And it's not just a saying. You can see that over on our website, our YouTube channel, and our Facebook Live. We're putting up patient success stories all the time to give other people hope. And so, Misty, we've been together, almost your whole working career.
Right.
Not quite. And let's see, we moved into our office in 2007. I kind of think you were the first person that we hired.
I think so.
Okay. And so you came into the office, and tell us a little bit about, you started off, I think you were doing the therapies, right?
Yeah.
All right. So when we say therapies, kind of just tell people a little bit of what that means, because I'm not sure that you knew about therapies before you started,
Nope.
right? Like you learned all this stuff, right? So there's some really cutting edge therapies that we have at the office. This is where Misty started. Now, Misty right now is the team leader. Sometimes I wonder why I even go to work, because she literally could run a country, no problem. She runs the office great. So Misty, tell us, just give people a little bit of background. You grew up in a little small town.
Yes.
And what was the town called?
Grace.
All right. And then you moved to the big city, Pocatello. I knew you were doing a couple different things, but you came in, you applied for the job. We started doing therapies, and kind of tell everybody, like, what's a therapy and what did you learn?
Well, back then it was mainly just chiropractic.
Okay.
So we did a lot of ultrasound and interferential and massages. And then it was a few years, and then you broke down all those walls and built your body shop. And then we moved from that to more of your injection therapy, but it was a lot of kind of the same therapy, but mainly focused on chiropractic back then.
Yeah, so that was right when we were kind of coming out. My dad was saying, you got to figure out what's your white hot center. Mm-hmm. And he was a chiropractic orthopedist, and that means that he did non-surgical orthopedics. And so, and we had, 6 adjusting rooms in the office, and we had all these therapies. And when people came in, Misty, that were like, oh, I can't bend my back or I can't bend my neck, and we'd say, let's do ultrasound. Like, tell us a little bit about what that means.
The ultrasound?
Yeah.
It was this little old wand that sent waves back and forth and helped massage your muscles and get everything loose before the doctor would adjust you.
Yeah, it's perfect. So ultrasound is a cellular massage, and then we'd also do some interferential you mentioned. So kind of educate people a little bit about, interferential.
The interferential are those sticky pads that you put on the sore area, and you turn the machine up, and it sends waves, like ocean waves or whatever, on your back, or you can do the pulse
Right. And it helps to break up muscle
pain
tissue. And so we were doing quite a bit of that. My dad said, find your white hot center. And I had a doctor hero in Oklahoma, Dr. Taylor, that was doing this vitamin infusion stuff. And I'm like, oh, I really want to do that because it really helped my dad when my dad got sick. And then you kind of saw a metamorphosis in the office. So we took down some walls and we expanded into having basically an injection room. We got rid of all of our dressing rooms and things like that. And then Misty moved up from therapy to being an assistant. And so you were helping me do stuff. And I can't remember how long was it. I guess a couple of years that you did that.
Yeah, a couple.
And so we were going along, and then we had 4 chairs in our IV room where we were doing vitamin infusion therapy. And at first I was kind of doing them all myself, and then we started getting bigger and bigger. And eventually Misty said, hey, I can run this room better than you. And she did. So Misty, kind of tell everybody like a little bit about when we have sick people come in and we want to skip the stomach and we want to put some things into the body more efficiently, we do infusion treatments. And you work with people all day. I don't know how many thousands of infusions you've done. I mean, it may be even 6-figure infusions, hundreds of thousands maybe. Yeah. But what are some of the common questions that you get asked in the infusion room, and then kind of what are some of the responses?
The main one we get is, how am I going to feel afterwards?
Right.
Are you going to have like a detox reaction, or am I going to get sick, or just basically how you're going to feel?
And as we started off the radio segment, it was like what we wish people knew. But I can't help but thinking, I wish people knew about infusions, because usually when they come to the office, they don't know anything about them.
Nope.
And so when people say, what's in it and how am I going to feel, what do you tell them?
I tell them there is really high doses of vitamin C, high doses of your minerals like your calcium, magnesium, potassium. There's all your Bs, B12, B5, B6. Those are in the vitamin ones.
Right. And do some people feel better?
I'd say the majority of them do feel better when you give them the immune one.
Right. So the immune ones, we've got a whole bunch of vitamin C and we've got zinc. And we want everybody to feel better immediately, but sometimes people feel worse. And Misty, why do you think that is?
I kind of feel like it's because they're kind of like a clogged toilet, right? Their body's been building up all this bad stuff, and so the vitamin C and Bs are supposed to help flush all that out and get everything moving. And so you do feel kind of crummy at first, the first few times.
Yeah, I usually tell people, look, when we start to, again, that clogged toilet analogy, the only way to unclog the toilet is we have to literally stir everything up so, and eventually can drain. And so it's not really surprising when people say, I feel better. It's also not surprising when they say, I feel a little different, which is good. But you've seen some pretty crazy responses, like crazy good responses in the IV room. And so as we were getting ready for the show, I said, hey, maybe we should talk about a couple different cases. Can you tell me about like one of the cases that really sticks out for you?
Like just recently?
Yeah, I mean, there's been some like pretty amazing ones. Like we saved Joanne's foot from amputation. We helped, Mud get off the liver transplant list. We got Amanda wheelchair to walking. But like it's, I'm going a little bit out of order, but sometimes you've told me that we see such big changes that you go home and tell your family, and then your family doesn't believe you.
Right.
So one of the ones lately, I mean, just pick one of someone that jumps out at you.
Like recently, I was talking to Gayla.
Uh-huh.
Gayla was telling me about how like much better she's felt over the recent times that she's gotten here. And
so what was her original thing? She had, fibromyalgia, she was chronic fatigue, she was just absolutely wore out. And she hadn't been in, I want to say, about 5 or 6 years. I think it was 6 years. She came in 2017. And then kind of walked me through her journey, because this is a perfect person to talk about, because people are out of hope, they're out of time, they're out of options. They feel like, oh my gosh, I'm going to live sick for the rest of my life. That's what, Gayla's story was. And then as we start dumping in all these building blocks, it's kind of fun to see people's energy come back on.
Yeah.
Like their vitality comes back. So if someone's getting ready to receive this, kind of walk us through what happens in there. And then, like you said, just kind of tell us a little bit more about Gayla's story, because I think almost everybody could relate to this.
Mm-hmm. I like Gayla because she came in quite a bit at the beginning,
Right.
and then she hasn't been in for a long time, and she just wanted to pick me up. I feel like we gave her some DMSO recently, and it really changed her life on her pain.
Right. So hold on a second. What is DMSO? Right. So it's dimethyl sulfonyl oxide, and it's a universal softener. There's one really mild side effect, which is what?
It smells like cream corn.
Yeah, it smells like cream corn, but it's amazing for circulation and for, post-stroke applications and pain applications. It makes everything move better. So we gave her an infusion of that. We gave her some DMSO, which is basically refined tree sap. And then what happens to her?
She feels better.
Yeah, I love it. She absolutely feels better.
It.
Okay, we also do some other IV treatments in there. We do a dilute hydrogen peroxide bag that helps different things. So tell me just a little bit about that.
The hydrogen peroxide, I really like that one because it's really good for when you have cold, flu, you're sick.
Yeah.
It definitely changes people's outcome when they have shingles. It's just I don't know. It's a great one.
It is. Now, you need to tell everybody it's not straight hydrogen peroxide. What is it?
So it does have hydrogen peroxide, manganese, and magnesium.
And it's about a 1 to 100 dilution. So I had someone on social media when we were talking about one of our success stories of someone that was really sick. I actually think it was Joanne's story. And we were saying we're giving her some IV hydrogen peroxide. And I said it was diluted. And they're like, oh, my gosh, like you're going to kill someone. But how many hydrogen peroxide treatments do you think we've done at the office?
30 a day for 15 years.
Yeah, so 30 a day, 5 days a week. So there's 150 a week times 50 weeks. I mean, that's like,
Quite a bit.
geez, 4,500 a year. We've probably done 50,000 things. Have you ever seen anybody react to hydrogen peroxide?
No, besides just overreacting their system and making them have
Which
a
is
healing crisis.
Yeah, so the healing crisis is a mild, like we're starting to detox. But I love that way of getting hydrogen peroxide into the system. We also do some other treatments that I wish people knew about these therapies, and I'll pick it up in the next segment of explaining more to it. But we're on a good roll about the miracles that we create in the IV room. We talked a little bit about vitamin C and dilute hydrogen peroxide. Misty, tell people what is in the dilute hydrochloric acid bag.
Hydrochloric acid is a drain cleaner. It drains your lymphatic system.
For sure. It changes the hydrogen ion content in the lymph nodes.
Yep, same thing. It's a 1 to 100 dilution, and we put it in usually 100 saline.
Right. So we have a saline, then we put this hydrogen peroxide in there. It's from that paper that I talk about on almost every show that says 3 years of hydrochloric acid therapy. It was about a doctor named Burr Ferguson that went over to Africa in the late 1920s. It's kind of a precursor to Doctors Without Borders. And he found all of this chronic illness and malaria and Chagas syndrome and all of this stuff. And he found that using dilute hydrochloric acid, either orally or more efficiently IV, changed the hydrogen ion content of lymph, and it got rid of it. Matter of fact, this is one of the things that I think is so important to do for chronic infections like Lyme disease and some of our cancer support therapy and some other things. But it's not, Misty, it's not just limited to IVs, because there's some other really neat things that we do in the office, and I always call it the BC shot. Mm-hmm. So tell people, what is a BC shot?
Yeah, so we put some B vitamins in there,
Mm-hmm.
your B12, B5, B6, B complex, and then we add a little bit of vitamin C into the muscle.
Right, so we do an intramuscular injection, and this is kind of a more sustained thing that we do for vitamins. And so, you guys, what we're doing is we are going over different protocols that we see miracles inside of our IV room. I'm joined by one of my very favorite people, Misty. Misty's been with me for 16 years, And if you see us on Facebook or YouTube, you'll think, oh my gosh, it's not possible for her to work for someone for 16 years because she doesn't look like she could work for someone for 16 years. So she runs the IV room. She also runs the team for us at the West Clinic. We're on Voice America with Dr. Jason West and America's Healer. On our next segment, we're going to be talking about what we wish people knew. Now, we started a little bit about Misty's journey. She started off as a therapist, and then she became my assistant. Then she kind of nudged me out of the way and said, I can run the IV room better than you can, which is absolutely true. And we got on a little bit of segue of the miracle vitamins that we do inside the IV room. When we come back, Misty and I are going to pick up exactly what we wish people knew on their healthcare journey, and also what we wish they knew when they came into the office, because just because you haven't heard about a treatment doesn't mean it's not effective. It just means that you've heard a lot of drugs and surgery because it's really good marketing, but man, there's some really cool stuff that you'll be aware of. So stay with us into the next segment. Dr. Jason West and Misty on America's Healer, Voice America Radio. We'll pick you up in just a minute.
You're listening to America's Healer with Dr. Jason West. If you have a question for Dr. West or his guests, feel free to join us on the show at 866-472-5792. That's 866-472-5792. Now, back to the show.
All right, thank you. And we're coming back to America's Healer on Voice America Radio. I'm Dr. Jason West. I practice in a little railroad town in southeastern Idaho called Pocatello. And I've got told a couple of times, hey, Dr. West, where do we get more information? So if you'd like more information, let me give you a couple of resources. One, the easiest way is to go to our website. It's westcliniconline.com. And we have all our resources there. We have articles. We have a bunch of success videos. We have a blog with healthy recipes. And a lot of the stuff we're talking about, like in our first segment, Misty and I were talking about the vitamin infusion room with vitamin C, and then we talked about a wonderful solvent that's good for pain called DMSO, which a lot of people know what DMSO is because of its application in the veterinary world and for horses and for cattle, and a lot of cowboys know about DMSO. And then we moved into other treatments that are available. One of them is dilute hydrogen peroxide, which is literally like putting Alka-Seltzer in the body. You put extra oxygen in there. It doesn't make the blood foam up or anything like that. It just helps to get extra oxygen. It's so good for infections. And then where the infections go is the lymph nodes. And so Misty and I shared a little bit about dilute hydrochloric acid. So Misty's journey and why she's so important to me, she literally, when we moved into our new office, she literally was my first hire. And she started off doing specific therapies, ultrasound and inferential for muscles and musculoskeletal pain. And then as we started learning more and more about restorative medicine, which is how we're trying to take chronic conditions and literally do building blocks, she moved in and did some work with me as my assistant. And then she took over the IV room, and then she took over the office. And amazingly efficient. I'm super lucky to have her as part of the team. And then when we were getting ready to do the radio segment, I'm like, hey, Misty, let's do the segment. And she's like, what am I going to talk about? Mm-hmm. And I said, well, it's what you talk to people every day about. So being a restorative medicine clinic, and I like that word a little bit better than functional. Functional medicine is how everything is functioning. Restore is like how we get people better. And so I was asking Misty on the break, like some of the things that we wished people knew. And Misty, I don't think you grew up really in an alternative medicine family.
No.
You didn't. So I think everything that you've learned over the past 15, 16 years about restorative medicine has kind of been from the office.
For sure.
Okay. So when someone comes in and they're suffering from, fibromyalgia, or they're wanting to like have less side effects from chemotherapy or radiation, or they've got, an autoimmune disorder, what are some of the things that you wish that they knew before they started?
Just basically that they have a whole realm of options that they probably didn't know before. Like you can take all sorts of supplements to help you long term. You can take IV therapy. just everything. There's just another world, really.
A whole nother world that most people don't know about. It's not marketed really effectively. So really everybody thinks, oh, when I'm sick, I go to the doctor and I get a prescription, or I go and they need to do types of a surgical intervention, or I need an antidepressant. But you've done a lot of work and helped me a ton in the supplement space. Mm-hmm. So you help me with the ordering, we do the shipping, and you see a lot of stuff coming in and out of the office. And I know some people are like, well, I tried those supplements that didn't work. But part of it is it has to be a quality of supplement. And then there's some stuff that you're seeing that ships out a lot because it works. So tell me about one or two of those.
The one that pops into my mind right now is chlorophyll.
Okay.
Chlorophyll is a really awesome supplement that helps like clean your blood. It's got a whole bunch of vitamins and food packed in there that help like just smooth everything out.
I love chlorophyll because it's refined plant blood. Like you said, it has all your vitamins and minerals in it. It really helps to clean blood. I liked using it for, in skin conditions, psoriasis, dermatitis. I really like it for acne. It has a really nice hormone balancer component, which means if your body is low in thyroid or adrenaline, even some testosterone, estrogen, progesterone, it gives your body building blocks to make them better. We also send out a lot of vitamin C, liposomal C, and we do a little bit of vitamin D. And so, Misty, if I was to say, what are you guys using vitamin D for? What would you say?
The number one I would think would be your mood.
Yeah, it's so good for emotional stability.
Yep, and being sick. This is the time of year where everyone's got the cold or the flu or something in that realm, and vitamin D just helps everything with your immune system. It's an easy supplement to take. It's high in vitamin D, so there's the one we have is 5,000 IU.
Right.
So it's really good. Just everybody should be on vitamin D, really.
Yeah, I really think you're right. I love vitamin D because it's probably easier to write a book about what vitamin D doesn't do. It helps with moods. It helps with viral infections. It really helps, your bones and to have healthy bone function. I've seen it do really good things for blood pressure. So for everybody out there, this isn't meant to substitute a doctor's advice. I can just tell you what I take. I really like to take about 10,000 units a day in the wintertime and 5,000 units in the summertime. I think vitamin D is great. There a long time ago, people were thinking that you could overdose on vitamin D. It may be possible. You would have to take so much to really causing. I've had people that have gone through different protocols on the internet where you take your body weight in IU every day. So some people are coming in, they've been on 200,000 units of vitamin D for 3 or 4 years, and their vitamin D levels to get to around 100. So I'm not trying to say that there isn't any risk, but you really have to deliberately just go crazy on it, in my opinion, to have problems with that. So, Misty, we talked a little bit about chlorophyll. We talked about vitamin D. We have a special type of vitamin C at the office that's different than just ascorbic acid powder, but we ship a lot of that too. And what's that?
The liposomal C, the deep C.
The deep C. And why would you think that it works better than just pills?
Because it's liquid.
It's liquid.
And it's easy to absorb.
It's easier to absorb. So literally there's a fat source, and we mix it with sodium ascorbate, and it forms this wonderful liquid therapy that isn't destroyed by the hydrochloric acid of the system, and it just puts tons and tons of electrons in the area. The other thing we were talking about, Misty, as far as what we want people to know before they came in the office, is part of our workup. And so part of our workup is way different than most medical workups. And how would you describe that to people?
The microscope.
We do the microscope. We do some energy testing. We do some standing line blood pressure. But let's just start with the microscope.
The microscope is it's cool because you, as a patient, get to actually see your blood.
Right.
You actually see what the lab or whoever would be looking at your blood would actually see. So it's cool because you you actually get to see your white blood cells and your red blood cells and how they look or how they should look. So it's cool because in your office there's a big old screen, and so you actually get to witness that and see. And then as you come in and do your reevals, you get to see the progression and how it's getting better. So it's a cool just research purpose, I guess, just to see where you started and where you ended, besides just looking at a piece of paper with a bunch of numbers on it.
Yeah, I really like that too. And I tell people, looking in, doing our research project, which is we want to turn people into their own researchers on their own health. So it's a really big thing for us to educate patients. We're always giving out handouts. I'm always referencing, a YouTube or a podcast or a paper, referencing books. And I want people to know, this is one of the things I wish they knew, is just that you kind of got to know, or at least you got to research what's happening so that you can turn into your own advocate. A lot of times in medicine, or at least when I first started my career, there was a lot of, I guess, dogma or stigma in the doctor space, because it felt like everybody's saying, here, you take 2 of these and call me tomorrow. And that doesn't work anymore because people have Google at their fingertips. And so they are research. I want to be part of that research process. The other thing that we do is we do this standing and lying blood pressure. And so, Misty, when patients ask, why does he do it that way? What do you tell them?
I usually try to explain that it's the Ragland's test. It's a way to take a good picture of your adrenals. And when you do it when you're lying down in a resting state, your body should be easier, right, for your blood to go through your system. And when you stand up, I think it should drop a little bit, but it should stay the same.
Yeah, your pulse rate should stay the same. And you want all of the hormones in the body to kick in so that the blood doesn't run out of your head. Mm-hmm. So it's a really nice way for us to do. It's such a simple and cost-effective way to look into your hormone world. And so that if that Ragland's test is off, that there's probably a thyroid component and there's an adrenal component, but we don't have to necessarily go to the expense of running those. I can just say functionally, it's not looking right. And then the other question that came to mind when you were talking is, you spend a lot of time with people in their chairs when they're getting their vitamin infusion treatments. And when people say, how do I describe to my family what treatments I'm getting? I know you've been asked that question. Like, how do you help them to go back and say, oh, at this restorative medicine clinic, they started doing X treatment, Y, Z treatment. How do you help people through that?
That's a tough one. We do have a lot of handouts and paperwork on it, but I feel like if we can explain to them really good what they're getting when they're coming in, it's easier for them to show them. But the best way is just to have them come in and experience it themselves.
It's true. It's kind of you have to see it to believe it type
right.
thing.
Yeah, but just to get them the proper paperwork is the best way. Help them to understand what they're doing when they're in, going through each room where they understand what treatments we're doing on them is the easiest way. But it's a lot.
It's a lot. And that's one of the reasons why I always ask people for their, video experience when they start to improve. And I learned this from a medical mentor, a hero of mine, Dr. Rowan in California. I went to a workshop at his office, and he just had tons of videos that he would record on his phone. And so, Misty, when we do this a lot, sometimes I get busy and I don't ask as often as I should, but we have hundreds of video testimonials. And if I had to ask you if there was one that was a favorite or one that sticks out, who would you talk about?
I probably have to say Mud Murdoch.
Okay.
He's been a great...
It's been an amazing success story. So I think when I look back, it was either 9 or 10 years ago. He came to the office, and what was wrong?
He was in liver failure.
Yeah, it was, and they were literally like, look, you have, 2 years to live, and that was 2.5 years ago. Yeah. It was past the time that they told him that you're going to be there, and Mud's turned into, one of our favorites. He's been on our YouTube channel. He's been on Facebook. Like we've had extensive interviews and stuff with him. But tell people a little bit about, one, what we did for him, and then two, you got to see his progression at a closer level than I did. I mean, I would see him and I'd wave to him and I'd be working with other people, but like you were the one that helped him. You were the one that got the treatment. So what did you see?
Yeah, when he first came in, he was very yellow. His eyes were yellow. His stomach was like extended out. He was tired and just run down. I think mentally too, he was almost shut off.
Yeah, he was kind of like there's no hope.
Nothing you can do.
Yep.
I feel like it was his wife or his sister. Someone had him come in, and ever since then, like I feel like he won't leave. He loves it. He trusts us. I feel like we give him hope.
Yeah, and it's been almost 10 years. What was fun about him is like when we did his blood test, like all of his enzymes are normal, and his doctor was saying, "Wow, it's absolutely a medical miracle. It wasn't supposed to happen." And my response is, well, when you start functioning on restorative medicine, which is what we're doing with the IVs and the infusions and the supplements, like we want to give building blocks so the body can get better. But we also, Misty, talk a lot about lifestyle and what people can do to change. And so we talk about this almost every meeting. Like if you had to give people just some simple rules, if they're listening across the street or across the country, they're not necessarily in the office, what would be some of the easy rules to follow that should help them?
Their diet?
Yes, so diet's one. And so has your diet been impacted since you've been in the office?
Yes.
Okay, good. Because Misty came in as a chicken nuggets, Dr. Pepper, big fan. And over the years, I've seen you eat a lot better. I'm proud of you. But what you would tell people, what should they eat? And then any other rules that you'd like to share with them? We got about a minute to go.
We usually tell them to have a rainbow on your plate.
Yeah.
The basic, I feel like everybody says that. You need vegetables and fruit and meat and salad. Like just have a variety. They always say cut down your sugar, try not to drink a lot of pop or coffee. That's usually pretty hard, but if you can change the basic things and stay on supplements as best you can and on a regular basis, it really does change.
It does. That's great advice. So rainbow colors, really fast. Tell everybody about liquid intake. What should you be doing?
What is it, like half your body weight?
Have your body
Which
weight
is
in
a lot.
ounces. And we try to stay or urge people to stay away from, too much sugar or carbonation. All right, guys, you've been listening to America's Healer on Voice America Radio. I'm in studio with Misty. Misty has been great as far as working her way and doing everything inside the office. We got some exciting additional information to pick up for us after the break, and we'll be right back.
You're listening to America's Healer with Dr. Jason West. If you have a question for Dr. West or his guests, feel free to join us on the show at 866-472-5792. That's 866-472-5792. Now, back to the show.
All right, everybody, welcome back to America's Healer on Voice America Radio. Just remember, if you can't pick us up on live, we're also on Spotify, we're on Pandora, we're on Google Podcasts, we're on Apple iTunes, we're on iHeartRadio. You can even see our radio segments on Facebook and also YouTube, which is Healthy Healing TV with Dr. Jason West. We have about 600 videos over there on different patient conditions and treatments that most doctors don't know about. Anyway, that being said, I'm joined in the studio with my team leader that helps coordinate everything in the office and has seen miracles literally for the last 15, 16 years. It's really fun to work with someone that's committed to work and likes to come to work. She's told me that a couple times. I have to get away from other stuff and come to work where it's my safety and my refuge. And I feel the same way, so it's kind of fun to talk about that. Misty, if we were going to tell people that there was a couple big takeaways, like if we could kind of summarize this, what would you say that their takeaways are?
Number one, that it is possible for your body to recover. We are a healing machine. That's what our bodies are meant to do. Number two would probably be that we have a lot of advanced therapies to help people get their lives back in our office. And why most doctors don't think that way. I don't think they're not educated. They just
don't know about it, right? They're just not exposed to it. And so I love what you said about, if we put building blocks into the system, like people can heal. And so that's why I really like telling people when they say, what kind of medicine do you practice? And I almost want to say, look, if we put these blocks back into your system, if we get your vitamin C levels to come up, if we can flush your lymph nodes, if we can get energy into your system, and then there's so many ways that you can heal. I love that. It's kind of funny when we have patients say, I talk to my regular doctor, or I talk to my real doctor. I hear that quite a bit. And they say, what you're doing is impossible. And I said, I know that they think that, but we've been doing it this way for over 100 years. Mm-hmm. And so maybe it's impossible for the traditional medical model, but it's not impossible at the office. And so we have some fun therapies that we do at the office. We've talked about doing vitamin infusion therapy, which is kind of my favorite, but we also have some really cool way to reset the nerves and pain patterns and organ function by doing neural therapy. And so, Misty, I want you to tell people a little bit about neural therapy, and I kind of want you to tell them a little bit, like no one likes it at the beginning, mm-hmm. but everybody seems to like it by the end. Right. So what's neural therapy?
Neural therapy is it's like an advanced acupuncture. We do little injections on all the acupuncture points. It's supposed to, like your computer, shut your body nerves off and turn them back on or reset them. And it's really cool because it does hurt at first.
Yeah, so what does it feel like? And kind of what's the environment that we do that?
I feel like it's a bunch of bee stings at first because your nerves are just firing and they're mad and they're angry. And so it's
intense.
Yeah, at the first. And then, like you said, I do feel like as they go on, people are like, that's exactly what I want. Yep. I want neural therapy. And it is easier and easier as your body, I feel like, calms down on the nerves.
Yeah, so we got a lot of nerve memory that happens either from trauma or infection. Like you'll see someone like a roper that comes into the office and they'll be practicing. They'll get a rope caught around their finger, and then the cow takes off, and unfortunately it can pull their finger off, and they'll come in the office and be like, my finger's killing me. Even though it's not attached to the body, we call that phantom limb syndrome. And a lot of times with chronic healthcare conditions, it's not that they had an amputation, but their body is thinking, oh, this is normal. It's normal for us to hurt. It's normal for our stomach to not work. It's normal for our hormones to not work, or it's normal to have headaches. And the neurotherapy helps to reset that. So I know that there's been some kind of funny experiences back in your work area of people saying, oh my gosh, like he did it, or Shelby did it, or Dr. Nelson did it. And then, like you said, later on, they're like, I can't wait for neural.
Yeah, especially with headaches or stomach. I mean, those are the main ones that I feel like make, people with long-term headaches, it makes it go away.
The other thing that we do is, if you walk into our office, Misty, there's kind of two sides. So what are the sides?
Right. I always tell people we are split kind of down the middle. When you come into our office, the whole left side where our nurse practitioner is and Dr. Nelson, Dr. West, that's our pain side. So we help injections, we do joint therapy, all of our actual therapies on muscles and like where interferential is. That's the left. And then to the right is where we do the microscopes and the IV therapy. And that's our main,
I'm going to say our internal side, right? We have an internal side, we have a joint side. And, we were in the IV room the other day. I walked in, I was kind of excited to tell everybody about my son being on front page of the newspaper and how he's going through school. He's going to come back, and you made a kind of a funny comment that, so he's going to come back and work with us. And now I know how my dad felt when I was going to school. He would get all excited and he'd fumble around and he couldn't even talk because he was so excited. Right? And I feel exactly the same way. And when we were in the room, one of the ladies was saying, oh my gosh, can you do anything for bone-on-bone arthritis? And what did you say?
Yeah, the prolozone.
Right. So we have this proliferative therapy using advanced oxidative medicine called prolozone. And I don't know how many, people we've worked on together. I mean, it's got to be thousands that we've done. And so when people say, can you help bone-on-bone arthritis? How do you answer that for patients in the office or people that are on the phone calling?
I tell them absolutely. We have the prolozone Injections we do first, which is 90% of the time with the B12 solution in the ozone. We also do the PRP in the joint.
Right. So the PRP is helpful for, putting an extra shock absorber. That's called platelet-rich plasma therapies. We also do a lot of acupuncture, which I don't think you had done any acupuncture before you came in the office.
No, for sure.
And so, yes, it has to do with needles and things going into the skin. But what would you say about what people say about acupuncture?
It's kind of freaky, actually.
Okay, but freaky in a good way. Like,
right.
I got to make sure if our listeners
Yes.
understand. Like, we're not saying like it's not to like we're sacrificing a chicken or anything like that. I mean,
No.
it's just a different way to treat people. So, you've had some acupuncture.
Yeah.
And what is the experience, and what is it like?
It has like a calming experience, like all those points. It feels like it calms your meridians down. Like it just makes you feel like sensei.
Yeah, I feel like it's zen. Like, it really just helps you to wind down. What are some of the treatments that you've seen respond to acupuncture?
The one, like with Dr. Nelson, I feel like he's the head person at our acupuncture, but he'll put like a needle in your big toe and it'll make your stomach ache go away. It's weird, like all your meridians go through your whole body, but it's kind of cool that he knows exactly where to put it to make that ailment go away.
Yeah, so I love acupuncture because you're just trying to get energy the right place. Some areas have too much energy, they're inflamed and they're irritated. Some areas don't have enough energy, and so we kind of want to bring energy to that area. So we have some regenerative injection therapy, we have acupuncture, and some of the conditions, if someone was on the phone and said, what conditions do you treat? Misty, you've seen it all over the last, 15 years. How do you respond to that question?
I tell everybody we can pretty much help everything but male pattern baldness. I don't know, I've heard you say that a million times.
Yes, I wish I could find the cure for male pattern baldness.
Yeah.
And the reason why we think that, Misty, is because working together, we've seen a lot of people where we're just trying to get them balanced.
Right.
Like, if we can take their blood tests and look at those deficiencies, the deviations from optimal, and look at their energy scan and correlate our research project with how the blood looks, and then start going into, okay, if we just get the building blocks into the system. And you talked a little bit about some of the favorite, supplements of liquid vitamin C, and we talked about refined plant blood, which we call chlorophyll, and vitamin D, which helps just about everything. We also have kind of a cool mind wellness component. And, when you and I first started working together, like, that wasn't even on my radar. Like, I was like, yeah, well, toughen up. Oh, you have anxiety? I feel horrible for anybody that's had anxiety. I've had some anxiety later on, and I feel bad for saying this, but when people would say that, I'd be like, oh, well, you just need to power through this. You need to toughen up. But we've decided we added a mind-body component, and I think it's been really neat to add the office, because you can't separate the body from the mind and the mind from the body. Like, it's together. And so if one is imbalanced, I think it makes the other imbalanced. But walk people through kind of some of your observations or what you've seen in what we call wellness therapy, but it's mind-body healing. So we added that, components of it a couple years ago, but really about 4 or 5 years ago, we really put it in place. And when people are in the IV room saying, what can I do next? Tell us about mind-body therapy.
We have Kelly. We brought Kelly on into our office, and so she brings you in and has the consultation with you and kind of gives us a direction on where to put you. But we have the theta pod. That thing spins you around and puts you in the theta state. We also then move you to the RTMS, and that kind of brings you out of the theta state and back into a normal state. And then we usually put you in the red bed after that.
And when people say, okay, the RTMS, what does that do, and how does it help your brain function? And so what I mean by that is, we get you into the theta pod, which helps your body to relax oxytocin and dopamine. It helps to fire that. Then the RTMS is those little pads that go on your head. It's kind of a real mild brain massage. And then you mentioned something about the red bed, and I love the red bed. So when we say that, that's kind of our nickname for it. But what does the red bed do?
The red bed helps with your cells to get like moving. It helps with like inflammation and pain. There's the red light, obviously, 'cause it's glowing bright red, but there is like a white light. There's a few different lights in there. And it has a bunch of settings you can put for the different ailments you have. It's not just for pain. You can do it for skin, for acne. You can do it for memory, or, I mean, we use it a lot for pain. Yes, in circulation.
Yeah, for internal disorders, like it's, again, we're just trying to get the light uptake to put energy in the body. And you've heard me say this in almost every staff meeting. The reason why people start getting sick is because they run out of energy. Right. So if we get energy in the system, and I couldn't not talk about one of the other ones that we do, we call it the ionic foot cleanse or the detox therapy, or my little boys call it the sludge sucker. But you've helped me do a lot of those therapies. So tell everybody a little bit about what happens with the, quote, sludge sucker, unquote.
Yeah, we put your foot in a bucket of water. We put some salt in there, that pink salt, and the ionizer in there, it helps pull out stuff. I believe it helps your liver, right? Pull out all the junk, and it has a chart that lets you know where it's actually coming from. It's your joints or your...
Yeah, we want to get the water pretty warm so that the pores open up, and then we have a ionic charge for, I think it's 13 minutes of positive, and that pulls out negative ions, and then it switches polarity, and it's negative that's pulling out positive. Opposites attract. And I've seen a lot of people that really helps. I think it stimulates your acupuncture points. It also helps to, in my opinion, facilitate, circulation and some other things down in the feet. And we've seen some pretty crazy colors.
Yeah, and thick sludge on the top.
And it's always fascinating to be like, hey, what? I wonder what happens with that patient's life, that it comes out and it'll be green, or it'll be black, or it'll be, a weird color brown. And so I kind of think that we've covered just about the whole office. If you do a walk around, we talked about IV therapy. We talked about regenerative injection therapy. We've talked about how we get your nerves to reboot, a little bit of the workup with our research projects and a Ragland's test. And so I just wanted to tell everybody thanks for listening to the America's Healer with Dr. Jason West. I'm joined by my leader, Misty, my team leader, that she's been with me literally almost my whole career. Certainly at the beginning stages in 2001, 2, 3, I was just wet behind the ears. I was just a rookie or a greenie. And just about the time when I started figuring things out is when Misty joined the team, and she has helped me a ton. It's always nice to hire people that are smarter than you, because then they make you look really smart. So Misty helps coordinate the patient experience. And we wanted to just tell people, a couple things that we wish you knew. And this is what Misty said. It's possible for your body to recover. I really believe if we put the building blocks back in place, that happens. Most doctors don't think that way because they just aren't educated on restorative or functional medicine, even though I think there's more and more heading in that pathway. And some of the advanced therapies that really help people heal are vitamin infusion treatments, ultraviolet treatments, magnet, laser, hands-on therapy, and mind-body healing. So I just want to tell everybody thanks for listening. You can pick us up on different syndicated platforms, Spotify, Pandora, Google. Of course, we're here live every week, Fridays at 1 p.m. Eastern. We have tons of patient success stories on our YouTube channel, which is Healthy Healing TV, or if you go right to our website, westcliniconline.com, you can go in. There is a place called Success Blog, and you can click on it, and it has hundreds of video testimonials of people that have been all over looking for different healthcare. I'm Dr. Jason West, and here's to your energy, balance, and longevity. Me and Misty are signing out.
Thanks for tuning in to today's episode. America's Healer, Dr. Jason West, will be back next week to share more of his expertise, so don't miss it. Until then, have a great week.